Thank you again for joining us. Today's event will share further details on the new project, eligibility requirements to participate, details regarding the application process, as well as an overview of the technical assistance that will be provided to selected participants. With that being shared, I'd like to welcome the Center CEO, Sally Buck, to kick off today's webinar. Thank you for joining us and welcome, Sally. I will now turn the presentation over to you.
Thank you. Hello and welcome everyone to the Rural Healthcare Provider Transition Project Kickoff webinar. I'm Sally Buck, the CEO of the center and the principal investigator for this project, and I'll be opening today's webinar. We're really excited to present today the Rural Healthcare Provider Transition Project to all of you from hospitals and clinics in rural America, and to share the features of this new program. The National Rural Health Resource Center is a technical assistance provider that was awarded the cooperative agreement to implement this program under the Federal Office of Rural Health Policy. The center is a nonprofit organization, and we are dedicated to sustaining and improving healthcare in rural communities. We're the nation's leading health care technical assistance center in terms of number of programs, and the knowledge center in rural health. And in the center, we focus on 5 core areas, and I will share some examples within those. In transition to value and population health, the center has provided technical assistance to the state Medicare rural hospital flexibility programs of 45 states that have critical access hospitals. We have provided the Small Rural Hospital Transition Project the past 6 years, serving rural hospitals with financial, operational, and quality improvement consultations and education. Also, we're a technical assistance provider for the Small Rural Hospital Improvement Program, or SHIP, working with state offices of rural health to provide funding in the areas of meeting new payment systems and preparing for value. And also, we are the provider for the Delta Regional Community Health System Development Program that works with rural Delta communities to address their healthcare needs and strengthen the local healthcare system through comprehensive technical assistance. And the center has been working with the Federal Office of Rural Health Policy for 20 years and been in existence for almost 30 years. In today's webinar, we will provide an overview of the program and discuss the eligibility and the technical assistance provided through this program, and the project expectations. If you're considering applying, how does the timeline work for the project activities? And we will review the application process and how the selection will occur and the educational opportunities available throughout the project through the year. And in our Rural Healthcare Provider Transition Program team, these are the folks here at the center who are involved. And my role is primarily with the serving in oversight and working with the Federal Office of Rural Health Policy and our contractors in Rhonda as we develop the design of the program. Terry Hill's our senior advisor for rural health leadership and policy, and Terry will be working with the advisory committee and helping in the technical assistance design and identifying educational needs. Bethany Adams is a program director and overseeing the project assessment and evaluation. Rhonda Barkus, program manager, will be working closely with the Federal Office of Rural Health Policy and has been already in terms of eligibility in the application and guiding our work plan, day-to-day activities. Angela Flynn, program specialist, she'll be providing technical assistance with the selected sites and also developing education and resources with working with the Learning Collaborative. And Kiona Hermanson, our host of today's webinar, will coordinate outreach, our webinars, a learning collaborative, and website, and help us with our overall communications. I'd like to introduce Christy Martinson from the Federal Office of Rural Health Policy. Christy is the director of the Hospital State Division at the office, and we have worked with Christy for a number of years and really appreciate her experience in rural hospital state programs and her wisdom of working with state offices of rural health and rural hospitals, as well as other agencies. Christy?
Thanks, Sally. And I won't turn on my video because I'm dialing in from a rural area, so not a lot of Wi-Fi bandwidth here. So I want to make sure you can hear me.
Yes,
but
we can.
Thank you so much to all of you for being on the call today. We're really excited about this program. Janine's been working with the great staff at the center over the past few months to get this program rolled out and out to you. We know when we started writing this program guidance about a year ago and put it out, things were a lot different then. We know there's a lot that you all are dealing with right now, and we appreciate all that you're doing kind of in this time of the pandemic. So this program is a little shift from what you may be focusing on, but just really want to encourage you to reach out if you have questions, if you're looking over all of the information that you're going to see today and wonder how you can kind of balance it all. Please reach out to this team. They're so great, so helpful. Really want to work with each provider, hospital, or rural health clinic to make sure that your needs are being met, and really understand that each organization has slightly different needs and is very unique in its own right. So thank you all for being here. Look forward to seeing what this next year brings with the program. So thanks so much to the center team, and look forward to hearing all the information that you're going to share today.
Thank you, Christy. Thank you for joining. This is a map of the hospitals served over the past 6 years with the Small Rural Hospital Transitions Program. And that was a Federal Office of Rural Health Policy program previous to the current one that focused on preparing hospitals for a future in value-based care and alternative payment. And we just want to give a sense of where those projects occurred. They were not nationwide, as that previous program had an eligibility component that limited the eligible hospitals to those under 49 beds were in areas of persistent poverty. And we will talk about the eligibility for the new program, which is much broader. But over the 6 years, we worked with many partners in on-site small projects in 19 states. And it was selecting hospitals from a total of 180 eligible. The impact of the SRHT, as we call it, technical assistance, are lessons learned and best practices that really will help start us on the right path as we move into the new program. However, we recognize the Rural Healthcare Provider Transition Project is also targeting rural health clinics as well as small rural hospitals. And in follow-up interviews with our SRHT hospitals served, we really got a sense of the impact of the resources and the consultations in moving forward. And we just wanted to provide a snapshot of those outcomes. So over the 6 years, we served, again, 52 projects, and hospitals most often reported increased days cash on hand, increase in patient satisfaction scores, improved accounts receivable, reducing readmissions, as well as realized savings from the 340B program. A return on community investment, or ROCI, conducted earlier this year found that the SRHT consultations had a $7.43 return for every dollar invested of federal funds, and a $1.97 return for the educational programs. feedback assessments and we conduct those every year with participating hospitals. We had 88% of the hospitals strongly agreed they'd recommend for others to participate in the project. So a very strong endorsement. And 120 different resources were created through SHRT over those 6 years. And that included webinars, guides, podcasts, and video spotlights. And what is possible by participating in a targeted consultation program such as SHRT? This was feedback from one of the hospitals we worked with in Georgia. You can see based on their current HCAHPS scores, 88% of their patients would recommend their hospital versus the national benchmark. So they had made a difference in their scores by raising up their scores to be #1 patient satisfaction in the region, and really felt that was from the SHRT project in terms of the consultation and recommendations and having a plan of action to put those into place. And our small rural hospital transition project also collected a number of outcomes through videos. So we wanted to make those available as well to share the types of experiences the center brings, as well as our partners in providing the consultation. And the purpose of the Rural Healthcare Provider Transition Program is it is designed to support small rural hospitals and certified rural health clinics, really strengthen their foundation in those key elements, value-based care, including efficiency, quality, patient experience, and safety of care. And we will guide those small rural hospitals and rural health clinics not currently participating in value-based care to prepare them for, position their organizations to be more effective participants in a health system focused on value. And this new program was awarded in August and began September 1st as a 5-year cooperative agreement. And now Rhonda's going to talk about the eligibility for the program.
Yes, thank you, Sally. So I wanted to share a little bit about the eligibility, but I do encourage you to go to the website where you can look at the entire piece of that. But the first piece is just that it needs to be an eligible small rural hospital as so it should be non-federal short-term general acute care hospital located in a rural area with 49 beds or less as reported on the hospital's most recently filed Medicare cost report. The other eligibility, of course, is the rural health clinics. And so while you would not necessarily meet this definition, the rural health clinic should also be non-federal. So it would not, FQHCs would not be eligible for this, but independent and provider-based clinics would be. A rural area is defined as either located outside of the metropolitan statistical area, or located within a rural census tract that is within an MSA, or is being treated as if it's being located in a rural area. So we encourage you, if you are not quite sure about that, please, there are certainly plenty of places on HRSA's website to be able to see what's considered rural, and you can even look at it by your county. But if you're having any struggles or challenges with that, reach out to us and we'll help you as well. Also, eligible hospitals can be for-profit or not-for-profit, and this includes faith-based hospitals. And we would also be including hospitals that are in U.S. territories and tribally operated hospitals. So a little bit about the application options. So there are actually 4 options for the way you could choose to apply. So the first would be a small rural hospital and a certified rural health clinic, again, either provider-based or independent, applying together under a single application. So the two wanting to come in, apply for the project together, and would be receiving the technical assistance together. Another option would be a small rural hospital applying alone without a clinic. Another option is a certified rural health clinic applying alone without the small rural hospital. And then the fourth option is a consortium of certified rural health clinics that are applying together. And again, the consortium then would receive the TA together, not each independently. So a little bit about the technical assistance. There are going to be two options for this, and I'm going to talk about the first one, which is the more intense, focused TA. So 5 hospital and clinics. So this would be 5 applicants, whichever way that looks, whether it's the hospital alone or clinic alone or hospital and clinic together or the consortium. So 5 of those applicants will be selected each year to receive focused on-site virtual technical assistance. This year it is going to be virtual. We're hoping that in 2022 we will be able to go back on site to do some of the technical assistance there at the hospital or clinic. But this more focused TA includes consultations and coaching to support implementations of best practices that lead to the adoption of transition to value-based strategies. There will be some clinical areas of focus that include efficiency, quality, patient experience, and safety of care. And in just a moment, I'm going to introduce Stratis Health that will be providing that really intense, focused technical assistance. And then you will also receive an assessment of the organization's readiness for assuming risk, and that will be done with Stroudwater Associates. In addition to that, for those 5 applicants altogether, we will be doing a learning collaborative, which will be to support their project implementation and sustainability. We'll also be doing a help webinar series on topics that are related to value-based care strategies. And then we will, at 6 and 12 months post-project, we do what we call wrap calls. And this is just to support the implementation of the project, see what kind of progress has been made, and see what we can do to continue to support that. So really for this piece of the technical assistance, you're looking at about 12 to 18 months as far as the work that we would be doing with you. So I'm going to pause here and turn it over. I think, Carrie, you're on the line, and we'll talk a little bit about Stratis Health's role.
Yes, thanks, Rhonda. Can you hear me?
Yes.
Oh, perfect. Hi, my name is Carrie Howard, and I am part of Stratis Health. We are a nonprofit organization that leads collaboration and innovation in healthcare quality and safety. And we have been around for many years in Minnesota. We are based in Minnesota, but we also have a long history working locally within Minnesota, regionally and nationally to support health improvement efforts with rural healthcare organizations and communities. At our core, we are a quality improvement organization, and we're really looking forward to the opportunity to bring our background and expertise in the rural field to this project. And you can go to the next slide. Thank you. These 3 faces here we're going to be your core team from Stratis Health. Sarah Brinkman has been working with the state flex programs and the critical access hospitals and other rural providers through the Rural Quality Improvement Technical Assistance, or RHPTP program, and has also led Stratis Health's work with the Quality Payment Program Small Underserved Rural Support, or the QPP SURS program. And her background includes working with rural healthcare systems to support efforts related to patient engagement and other improvement areas. Next is me, Carrie Howard. I have been with Stratis Health for about 4 years, working primarily with the Partnership to Advance Tribal Health program, which is a CMS-funded program to support Indian Health Service, Federal Indian Health Service hospitals across the country. So I provide direct technical assistance to the facilities here in Minnesota and the 20+ other hospitals across the country. I am very pleased to be joining this team as well. Before I started with Stratis Health, I worked for a large rural health provider, specifically supporting the quality and safety programs for the critical access hospitals and the rural long-term care facilities, home health and hospice services as well. And finally, we have Carla Wang. She is our Stratis Health rural guru. She's been leading rural quality improvement efforts for more than 20 years, both locally and nationally. And she is part of the FORHP, the Federal Office of Rural Health Policy, Rural Health Value Team, which focuses on rural participation in value-based care models. So we are really looking forward to working with you and learning some more about you and your facilities as well. Next slide, thank you. Our role in this project, Rhonda talked a little bit about that, but we are going to be providing the clinically focused technical assistance in these 4 main areas. So building infrastructure to embed improvement processes into your everyday practice, improving your patient safety culture, care coordination, and then also or patient experience and engagement. So we are really excited about this project and can't wait till next year when we can meet you.
Okay, thanks, Carrie. Appreciate that. And so Stroudwater team is doing the risk assessment portion, and I just wanted to double check that Eric Shell's not on the line. So Eric, if you are on the line, if you'll unmute, otherwise I'll go ahead and talk a little bit about Stroudwater. Nope. All right, so Eric Shell, Lindsay Corcoran, and Dan Given are going to be the 3 consultants from Stroudwater that will be working with the hospitals in the Focus TA. Here's a little bit of information about the financial risk assessment. So they will be working to determine your financial risk and identify strategies and develop tactics that can help kind of prepare you for taking financial risk in value-based care. They will also be able to make recommendations about how much risk your hospital or clinic is able to take. So if down below some of the anticipated outcomes. So the financial risk assessment guides the organizations in understanding the improvement opportunities for the organization. So you will be walking away with an action plan on how to prepare. Upfront and ongoing investment required to be an ACO. And then also just some recommendations around the maximum risk assumed under the various models and years in the CMS program. Here's a little bit about the organizational commitment. So what would be required from you around this part of the project? There will be a data request to complete some information, some preliminary data. Then Stroudwater will be doing interview calls with you all to talk about what are some of the main issues that you're seeing, and just to help them to dive a little bit more into the data, to understand the data. And then they will do a half-day meeting virtually with the key stakeholders to review the risk assessment, technical assessment, and then the technical assistance plan to participate in value-based care. Stratis and Stroudwater will both be working with you all also in that learning collaborative, and be providing some of the help webinars as well. So they will be the consultants for the TA and working with you throughout the other pieces of the project. So clearly, I mean, you can hear from Carrie's information about Stratis, and then some of you may be familiar with Stroudwater as well, that our consultants, our partnering consultants, have really strong experience and background in working with this issue. So and just before I dive to this, I just wanted to also point out, I think that Kiona had mentioned this, but as we're going through, if you all have questions, please feel free to go ahead and put those in the chat box so that, and then Kiona will be keeping an eye on those. And then at the end of the presentation, we'll be able to take some of those questions. So I told you that there were two pieces. One opportunity is for the 5 applicants that will be doing that really intense TA. The other is that we will also be choosing 20 additional applicants that will be selected to receive virtual TA through learning collaboratives. And that learning collaborative will be all 20 of the applicants working together, and we will be working with Stroudwater and Stratis again, and it will be really focused on promoting knowledge base and supporting readiness for future virtual on-site or virtual TA. So the hope is that some applicants might not be quite so ready for the really focused TA, but by going through this learning collaborative with the other applicants, this will position those applicants to be in a stronger position next year when we do our next selection of applicants. So the services in this include the peer-to-peer support and education on tools through the Learning Collaborative, and then also the Help webinar series on advanced payment models and value-based care topics. So 2 opportunities to participate in this project. So moving to some project expectation. Selected organizations will need to be ready, willing, and able to really undertake a comprehensive consultation project. And then the other piece is to be able to meet participation expectations. And again, the detailed information is included on our website about those participation expectations. Once we select the 5 applicants, if it's found that someone is not able to meet project and readiness requirements, and that includes deadlines, then that application will be placed back in queue and would be considered for next year. But we're really needing to have everybody on board as we're moving forward with the deadlines on this. Application timeline. So application has gone live and is being accepted from the 15th to midnight on January the 15th of 2021. I will just note that on our website, it says January 16th and at 12 a.m. And that's because we are taking applications all the way through midnight on the 15th, but so that actually is 12 a.m. the 16th. And we know that many of you are coming from different time zones. So that's why we didn't say end of business, for instance, on the 15th. After we select the first cohort to get to receive the TA, then we're going to be reopening the application again. And so we will have a rolling application process so that applicants can fill out the application at any point and don't have to wait until we are getting ready for year 2 to select that next group of participants. Also encourage you on our application website, we have an application guide, and it really talks about the application, what to expect, and gives you information of the questions so that you can prepare that in advance. Once you start filling out the application, it's not possible to save that information. And so we've included an application guide on our website in Word so that you could go ahead and put your answers into your Word document. And then when you sit down to do the application, you can just copy and paste directly into that application. There are 2 parts to the application. Some is scored, some is not. The first part is the pre-application screening, and this will just ask you, it's maybe 4, 5, 6 questions, and it's really to ensure that you are actually eligible for this project, because what we would hate to do is to have a hospital or a clinic take the time to fill out a very not intensive, but I mean, to take your time, which is so valuable, to fill out an application only to find that you actually are not even eligible. So when you do the pre-application screening, it will immediately tell you that you're not eligible and this is why, or it will go ahead and say you are eligible and it'll take you to part 2. And this is the meat of the application. So this includes 2 parts, the organizational details, and then the other is the organizational readiness. And so the readiness includes 7 open-ended questions that assess your past and current efforts towards preparing for value-based care. This is the only part, these 7 questions are it's the only part that is going to be scored. And from the scoring, that's how we choose the ones that are most ready. Also, next to each question, it will tell you how many points that question is has, or how many points you might be able to get. And the questions are very clear on what exactly is being asked to be able to get the maximum amount of points. And then the scoring. So as we're getting your applications in, we will be scoring at the center. We will be going through, looking through the applications and scoring. For any independent rural health clinic and hospital that apply together, you will get 2 extra points added to your final score. After we have the applications closed, we have scored all of those, then we will take the 10 highest scoring applicants. We will contact you and we will do a virtual interview via Zoom. This will be required to be considered for that intense TA. And the purpose of the Zoom meeting and interview is really just to dig down a little bit deeper and ask a little bit more detail about some of your application questions. We won't be asking you anything that wasn't on the application. Once we complete those Zoom meetings, then we will pull that information together, so the application findings and the interview, and then that's how we will identify the 5 applicants that are most likely to benefit from that focused TA. And then after we reach out to those 5 applicants and hear that, yes, we do want to continue on, then we will reach out to the next 20 additional applicants and invite them to participate in that virtual learning collaborative. So here's a visual of our eligibility and application. And again, you can see on this landing page, there's information about eligibility. There is the Word document for the application guide that you can fill out with your answers to the questions. And there's also a PDF document of that same guide. Also, you will see frequently asked questions. And again, and we've continued to add to this over this week as we have been getting questions coming in, either through the webinar that we provided last Monday or through folks just contacting us through email. Also, the webinar recording from today will be on that website. And so if there's anybody in your organization that couldn't attend that you think it would be helpful for them to hear parts of it maybe, then you could just certainly encourage them to listen to that recording. And then additional resources that will be coming soon. We will be rolling out the Help webinar series, and any eligible small rural hospital or rural health clinic is invited to attend the webinar series. So even if you decide not to submit an application, you are more than welcome to attend the Help webinar or even access those playbacks. The other thing that will be coming soon is the Value-Based Care Preparedness Toolkit. And Sally had shared a little bit about the Small Rural Hospital Transition Project that was previous to the RHPTP project. And in that SHRP project, we had created the Rural Hospital Toolkit for transitioning to value-based systems. So it's got a fabulous foundation of tools and resources. So we're going to take the toolkit, we're going to update it, we're going to add some new sections that will be very relevant to this project. So that will also be rolled out in the near future. All right, so I'm going to pause there and just see, Kiona, are there any questions?
Thank you, Rhonda. We do have a few questions. Our first question came in from Catherine Miller regarding applications, and she had asked, do the 5 applicants choose from the options provided, or do they get all of the options?
Good question. Yes. So the options provided through Stratis, you will be choosing one, and that will be based on some of the readiness. It will be based on your preference, and it will be also be you will be having a phone call with Stratis to talk that through, and so that they can help with some input as well. So it will be kind of a collaborative effort to decide which one of those you're going to participate, because each one is going to be pretty intense, and so you could probably only actually do one. Good question. Thanks, Catherine.
Perfect. Thank you. Our next question comes from Erin, and Erin is wondering, if you are a participant in an ACO, are you eligible for this program application?
Yes, as long as you are not in an advanced alternative payment model. And on the eligibility on the website, there's a link that takes you to what an advanced alternative payment model is, just in case you don't know. So as long as you're not in one of those advanced APMs, you're good.
Okay, thank you. Our next question is from Lisa, and Lisa is asking, if we are licensed for more than 49 beds, but we do not regularly staff more than the 49, can we get an exemption based on our average daily census to be eligible?
So we would be looking at your previous Medicare report. And so what I would encourage you to do is to reach out to us and let us talk that through with you a little bit, because the same issue sometimes happened with SHIRT. And so it depends on a little bit more detail. So we'd want to talk that through with you.
Thank you. And then this question was answered in the chat box, but I just think so others can hear it vocally. Are participation expectations the same for intensive TA as well as the learning collaborative?
Probably more strictly for the intensive TA. Certainly we would encourage, or we would expect, folks that decide to get just the learning collaborative alone to go ahead and make the commitment to being a part of that consistently, because those top 20 that are chosen, if we have 50 applications, that means there are 25 that didn't get chosen. And so we really encourage you, if you are chosen, that you do make a commitment to participating fully.
Thank you. And at this point, there are no other questions in the chat box.
Okay. Let's see. So I'm happy to pause for a moment and just see if anybody wants to unmute and ask another question. Sally, also, if you'd like to chime in on any of this, please feel free to do that. But if somebody would like to unmute and ask a question still, we're happy to pause for a moment. Nope. All right, so I'll hand it back over to you, Sally.
And the unique factor that this project, again, is it's not solely focused on small rural hospitals, but also rural health clinics, and especially those who are working together to provide healthcare in their community. And so we're excited, and the technical assistance team has experience working with small rural clinics as well as hospitals, and understand that transition from being a safety net provider and cost-based reimbursement to value takes a lot of learning and understanding and transition. And so it's not an expectation that in the end of the 18 months, as Rhonda talked about, that you're working in the project, that boom, you're in an APM, but it's to help prepare for and choosing maybe what model is best as they become available, either through your state payers, commercial payers, and Medicare. So again, our contact information is up there, so please reach out to us as you have questions. if you're not sure who to contact, you can send it to rhptp@ruralcenter.org. And we encourage you to visit the application page and the frequently asked questions, and we will update that again after today's webinar. And you can also look for the slides as well as the recording. The recording will take about a week to post that for those of you who want to go back and look at or share.
We'll actually be able to do that immediately, Sally.
Oh, okay, wonderful.
Yes,
Okay.
yes, that's good.
Okay, great. Well, thank you for joining today's introductory webinar about the Rural Healthcare Provider Transition Project. We were thrilled to have over 100 interested parties join the webinar today. So thank you. Have a great day.
All right. Thanks, everybody. Have a good afternoon.